people are not going to want to reach out and get the help if people are going to be labeled. So one thing I always remind people is to literally bite your tongue. Listen and think before we speak, especially when we are throwing words out there that can hurt. I mean, this is something we've been learning or we've been taught since we were little, but oftentimes, you know, we do throw out labels for people. I think it's also important for us to remember that we're not living in other people's shoes. And sometimes the best way to help understand somebody and what they're going through is to try and put ourselves in their shoes, right? I think the more conversations we have about mental illness, the more conversations we have about mental health, the more people will talk. The more people will be open to talk and open to share. So this is an interesting stat. This stat is coming from Canada, and it's saying that on any given week, more than 500,000 Canadians will not go to work because of mental illness, or even a mental health problem for that matter. So if we think about this number, I want you to think about short-term disability, long-term disability. Also think about vacation days, sick days, mental health days. These numbers are incorporated into that 500,000. I also want you to think about this. They say the number one reason for people being on disability right now, 2017, is depression. Right? So people are experiencing depression. They're not able to work. And one thing I do want you to think about, especially when you are working with someone in the office, in the workplace, even at home. For some reason, people think depression is something that you can just brush off. When we talk about mental illness, when we talk about mental disorders, this is a medical condition, and I really want you to remember this. It's a medical condition just like cancer or diabetes or heart disease. Mental illness is a medical condition. It's not a weakness, and it's not a choice. And if there's one thing I want you to remember from this workshop is that people do not choose to have a mental illness. People do not choose, for example, anxiety. I didn't wake up this morning and say, hey, I'm going to put on this blue shirt and these jeans, and I'm going to wear this mascara, and I'm going to have some anxiety disorder. It doesn't work that way. It is not a choice. And the sooner that we understand and appreciate that, the better we're going to get at having conversations with people. Okay? So please remember that. It is not a weakness. Also, remember, when we're talking about mental illnesses or mental health issues like stress, they are not necessarily static, meaning they don't stay put. They change over time. Sometimes mental disorders are situational. And an example of a situational stress, anxiety, or depression could be someone that's going through a divorce. This is only an example. Someone that is going through a hard time in their life, a huge change, where there is sadness, where there's maybe financial struggles, where maybe schedules are changing. Our mental health is definitely going to be affected during that time. Does that mean that we're going to experience anxiety and depression for the rest of our lives? No. However, there are some mental illnesses or mental disorders that can last a longer period of time. So this is interesting, and I really want you to think about yourself when you were a child. Or I want you to think about the children that you may have living with you. And if you don't have kids, I want you to think about yourself. And I want you to think about the anxieties or the stresses that you had as a child, 8, 9, 10, into your adolescence. What are the things that teenagers stress out over? Even someone who's 8 years old could have stressors depending on their home life, depending on what's going on at school, depending on what's going on at home. So they say that up to 70% of young adults living with mental health problems, and a young adult could be, I'm going to say 21-ish plus, reported that the symptoms started in early childhood. So Oftentimes, here's what happens. Our child, or even ourselves, and I'll use myself as an example, I would worry about things, and they may seem little or small to the parents, but I would worry about a lot of things when I was younger. I would bite my nails, you could pick your skin. A lot of people do different things, not be able to sleep. And oftentimes, parents sweep it under the carpet, or they think that it's a phase, they'll grow out of it. Now, oftentimes what happens if children, are not given coping tools, not given coping strategies, then they turn into an adolescent and an adult. And they still don't have those tools to learn how to cope when stress comes their way. And we all know that stress is going to come our way, right? Stress is not something that we can per se avoid. It's going to come because we're human beings and we're living our life. And stress comes and goes at different times in our life. And sometimes stress sits with us for a long time, depending on the situation. So a suggestion I have for you guys is, if you do have children in your home, if you do have young adolescents in their home, offer them some coping strategies. Now, you might be saying to yourself, I don't know how to cope myself. How am I going to teach my kid? All right? And that's a fair question, because, again, I'm going to refer to myself. I was never taught how to cope. And as an adult, I had to learn how to cope. And that meant taking workshops, seeing a therapist, and doing some work on myself. I have kids right now, and there are several programs in the Peel and Dufferin region, and even further than that, that offer workshops for kids. And a lot of them are free of charge. So after this workshop, Gail is going to display or email you a list of programs and services. I've sent you a list for Toronto. I've sent you a list for Peel. I've sent you a list for Halton, and I've sent you a list for Dufferin. I really want you to have a look through this list. There are counseling services, food banks, legal advocacy, you name it. There's tons of programs available that people don't even know exist. So I'm going to give you one example, and one example is the Peel Children's Center. They're in Mississauga. They offer workshops free of charge for kids, for young kids, I think as young as 5 or 6, all the way up to adolescents. And their workshops are free, but you have to register. You have to make a phone call and sign your child up. So that phone number is in the resource sheets that I've emailed over to Gail. That is one example. So if you think that your kid is struggling and they need some tools on how to work with stress, check out some of these agencies that work with kids, get them the tools that they need, because eventually they are growing, they are going to become an adult, and you want them to have all the tools that they need. This is an interesting stat. They say that 1 in 8 Canadians will be hospitalized for their mental health. And really, what I want to stress here is that oftentimes we, as a society, we make the assumption that when people are going to the hospital due to a mental illness, they're crazy, right? They're being strapped up, they're being thrown into the back of a truck, and away they go. What I want you to remember is that 80% of people who are going to the hospital because of a mental health problem are often going voluntarily, meaning they're taking themselves in, or mom and dad is taking them in. And why are some reasons that people visit the hospital because of their mental health? Several. The main reasons are maybe they don't know what's going on. They're not feeling well, they don't feel like they can cope, so they're going to the hospital to get help. Another reason is why people go to the hospital for mental health problems would be someone having thoughts of suicide, and going to emergency is definitely an option. Another reason would be medication. Somebody may be taking new medication and the medication's not working, or they feel the medication is making them feel off. They would also take a trip to the hospital, and when they do that, they're modifying or monitoring that medication. So there are many different reasons people are going to the hospital for mental health issues. I just want you to remember that people are not being tied up and taken away. For those of you who might not know, straitjackets, we've seen these in movies, we've seen these on TV, we hear about mental illness on the news oftentimes. Straitjackets are no longer used, and they haven't been used in a very, very long time. So I just want you to remember that people are going voluntarily for various different reasons. This is probably one of my favorite things to talk about because it really engages conversation. When I'm out running presentations in the community, I ask this question, right? So they say that twice as many women will be diagnosed with depression, and I ask the reason why. Why would women, twice as many women, be diagnosed with depression versus men? And I get an array of answers. Oftentimes people mention that women have a lot on their plate. Women these days are going to work and then having to come home, and they have work at home. I hear things like self-esteem issues, the media, women are more emotional. All of these things would be mental health factors, right? All of these things affect our day-to-day, definitely. But what I want you to remember are these two things. The two main reasons that twice as many women will be diagnosed. The first reason is that women have babies, all right? So women can develop something called postpartum depression. It is real. It is not just the baby blues, and it can take up to 2 years. Postpartum depression can last up to 2 years. Now, postpartum depression basically is depression. It happens after the child is born. Now, studies are now showing that men and also adoptive parents can experience postpartum depression as well, because there's a huge lifestyle change and environmental change. When babies come, there's huge amount of stressors, financially, worry, babies waking you up at all times of the night, and it's a huge change, and change creates stress, right? And stress can build into anxiety. Now, when we're talking about women and having babies, there's a lot of other things aside from change. Chemical balances in their brain are changing. Their hormones are also trying to balance themselves off. The number 2 reason that twice as many women will be diagnosed with depression is because the statistics are showing us that more women than men visit their doctor. Not for depression or not for mental health reasons, just overall, women visit the doctor more. So I want you to think about this, because if a woman visits their doctor, and even if it's for something like a sore back, oftentimes if the doctor is asking, you know, how's life, how are things, they say that a woman is more likely to open up because they're there. You know what, why not? Let's talk. So if there are any men listening or watching right now, I want you to think about this. I want you to think about why men are not more likely or more inclined to visit their doctor for whatever reason that may be. A sore back, an upset stomach, something like depression or anxiety. If you think way back, and I know this still happens now, I'm going to say probably less, but way back when, oftentimes young boys and young men hear things like, suck it up, boys don't cry. I want you to think about that for a second. And I want you to think about, have you ever heard things like that? I know, for example, myself, I have 3 brothers, and they heard it all the time, that boys don't cry, that they should be a man. This affects the way people think. When they get older, if we're telling a young lad that he cannot cry, that he has to suck it up, that he has to be a man, and he's 8 years old, what's going to happen when this 8-year-old turns 15 and 18 and 45, right? They're going to be less likely to reach out and get the help that they need. Because another thing that studies do show us is that there is that link, that tie, where men are thinking that if they do go to the doctor, if they do reach out to get their help, they are going to be conceived or perceived as being weak. But I'm here to tell you that it is not a weakness, right? So for the mathematicians in the group, I want you to think about this. We said 1 in 5, and we also said that number could be low. However, if we use the 1 in 5, this affects 20% of our population, right? 20 out of 100, which makes it more common than cancer, more common than diabetes, and more common than heart disease, right? And that's huge. So having said that, I want you to think about this. I want you to ask yourself this. What happens when your medical condition goes untreated? So if you went to the doctor this week and you've been having some issues, whatever those issues are, and the doctor comes back to you and he or she diagnoses you with diabetes, or they say, you know what, we have to send you for further tests because we think you have cancer, or you have heart disease, or you end up in the hospital with a stroke. I want you to think about these things. How often do you think somebody will go out and get the treatment necessary? I know that oftentimes when I'm out in the community and I can actually see a show of hands, I'd say 98% of people have their hands up. If they had cancer, if they had diabetes, if they had a stroke, if they had heart disease, they would definitely do what they need to do to get the help that they need. Now, oftentimes I ask the question, why? Why would you get the treatment necessary for cancer or diabetes? But when it comes to anxiety or depression or bipolar disorder, for example, why wouldn't we reach out and get the help that we need then? And oftentimes I get these sort of answers. So people, for example, talking about cancer would say that, well, cancer can kill you. So I'm going to do whatever it takes. If I need chemotherapy, if I need radiation, if I need to take medication, I'm going to do it. And I'm going to challenge you there on this one. You can die from any of these medical conditions. Diabetes, stroke, heart disease, and cancer. You can die. And I'm going to bet money that if you untreat these illnesses, that you can die. When we're talking about depression, I'm not sure how many of you know this, but depression is linked to suicide. Now, having said that, not every person who is depressed thinks of suicide. All right? Suicide on its own is not a mental illness. All right? I also want to clarify that. So if someone with depression is thinking about suicide and acts or attempts suicide and they die, is that not deadly? Are they not dying from this medical condition? So I really want you to think about that. Another thing that I hear from people are that they're afraid of the treatment options for depression or treatment options for their mental illness, because right away we go to medication and right away we go to side effects. And so a couple of things I want to stress here. Not everyone with a mental disorder or a mental illness needs medication. All right? So think about this one. When we are treating cancer, and I will share with you that I am a cancer survivor. This month is going to be 18 years that I was diagnosed. And I'm super happy. But let me tell you, if I did not take the treatment necessary, I probably wouldn't be here today. Did I just take medication? Absolutely not. I had surgery, I had chemotherapy, I had radiation, I had a bone marrow treatment. I saw a therapist, a counselor, because I had super anxiety. I was only a kid. I was 25 years old. I changed my diet. I tried to exercise. I tried to rest. So I just listed 8 things that I need to do for the cancer treatment and for my overall mental well-being. The same thing goes when we're talking about our mental health. When we talk about our mental health, when we are struggling, when we are dealing with an illness like depression, yes, medication might be the go-to. Medication might even help you. However, that's not the only thing that you're going to be doing. We also suggest environmental changes. We also suggest exercise. They say that exercising 3 times a week, and this is where you're breaking a sweat, can actually have the same effects as an antidepressant. So we got exercise, we have therapy or counseling. What else can you do? You could do yoga, you can read. Anything that you can do to improve your overall mental well-being is going to help with your mental health problem or struggle, right? Oftentimes people do tell me as well that when they are going to the doctor, medication is given right away. One thing I can stress, or that I want to stress, is that a 3-minute diagnosis is not good enough. All right. Oftentimes we go to the doctor and we give them a few symptoms and they give some prescription. So when we're talking about our overall mental well-being and our mental health, it's not the same thing as going to the doctor, peeing on a stick, and okay, you have a bladder infection, so here's some antibiotics. When I had cancer, as an example, my GP didn't prescribe me any medication. She referred me out. I went to see 2 oncologists, and they gave me treatment. They assessed my needs. The same thing goes here when we're talking about our overall mental health. If you are struggling, if you know someone who's struggling, I really recommend that you get them referred to a mental health specialist. And that can happen. You got to go to the GP and you need to request it. Some doctors might not offer that up right away, but it is something that you can request. All right. Another thing that I want you to consider or think about is your overall environment, right? What are some things that you can change about your environment? That also is going to improve your medical condition, if your medical condition is depression. If you have any questions about these slides, I want you to email them over to Gail. So in a nutshell, what I want you to remember is that if you need help, get the help that you need, ask for the help that you need, and ask questions. Another thing that I hear often from individuals is there's a lot of assumptions about who gets to have a mental illness, right? It doesn't really matter what your age, what your education is, what your income is, also what your culture is. It doesn't matter where you are from in this world. Mental health affects all of us. Now, they say oftentimes the onset occurs during adolescence or young adulthood. However, there are instances where people are older that experience mental health issues as well. Right? So there's a lot of factors that affect our overall mental well-being, and we're going to talk about that in a bit. One thing I wanted to talk about as well is a concurrent disorder. So if you've never heard this word before, it's pretty simple. A concurrent disorder is someone that is experiencing a mental illness or disorder, and they're also experiencing a substance-related disorder. So in a nutshell, someone who's using drugs or alcohol and is experiencing some mental health problems. Oftentimes, people are turning to drugs or alcohol or any sort of substance. A substance could be coffee or smoking cigarettes as well. People are turning to a substance because this is something that is helping them cope. So one thing I want to stress here is that our brain is very clever. Our brain remembers what we do. And when we are turning to something like a substance, drugs or alcohol, it remembers that. Especially when we are associating that substance, whatever it is, to a negative moment or event in our life. Our brain is going to remember that negative equals that drug or that alcohol. That's the simplest way that I could put it. And sometimes that can lead to a substance-related disorder. This is where people are abusing drugs, where people feel that they need the drug, where psychological or physical dependence can happen. This number, I just realized, it has to be updated. They say that more than 80% of those seeking help for an addiction also experience a mental illness or a problem. One recent study is showing that marijuana can trigger something called psychosis. Now, we can have a whole discussion about marijuana, and I know a lot of people have questions about marijuana and the fact that it's going to be legal soon. Marijuana and other drugs can trigger psychosis in some individuals. Now, what studies are showing is that when someone has an underlying genetic predisposition, meaning they have mental illness in their family somewhere, they are more likely to experience psychosis. If you're asking what is psychosis, the easiest way I can explain it is not knowing the difference between what is real and what is not real, right? So someone experiencing psychosis may have delusions, meaning they might see things that other people don't see. They might also experience hallucinations. The most common is hearing voices, okay? Again, if you have any questions regarding this, we can send them over to Gail. Actually, going back, there is a video if you're interested, and there are several websites that are available in relation to marijuana use. There's a video called The Downside of High, and it's from David Suzuki and the Nature of Things. It's about a 45-minute watch. You can find it on YouTube or just Google it. And it's pretty interesting. They basically monitor individuals who are smoking pot, and they're doing brain scans to watch or to check and see the difference in the brain. Mental health factors, when we take a look at all of these things on the slide, so we got temperament, genetics, our learning ability, our social skills, our parenting style, our family structure, our social conditions, our sense of belonging even. They all affect our overall mental well-being. I want you to think about this list. Our day-to-day life affects our mental well-being. If we go into work and we're butting heads with someone, for example, in the workplace, that is going to affect our overall mental health, right? We might be stressed, we might be in tears, we might not want to go to work, we might want to stay in bed because we don't want to go to work. These things can affect our day-to-day life. However, that doesn't necessarily mean that we have a mental disorder. We have a stressor in our life that we are dealing with and trying to cope with. These, however, are the risk factors. So when we talk about risk factors, we're looking at things like family history. So just like cancer or diabetes or stroke, for example, these things can be genetic. Same thing goes with mental illness. A mental illness overall, when we take a look, is a chemical imbalance in the brain. Like I said, it's not a weakness, it's not a choice, it's a medical condition. Also, physical factors can cause things like depression. So oftentimes people question this, they don't get it. And I want you to think about someone maybe who has been in a car accident. They're in a car accident, they have a sore back, maybe they've broken some bones, and they have to go through a process where maybe they're not working anymore, maybe they're disabled, maybe they're in a wheelchair, and they have to do physiotherapy. And also maybe they're taking medication to help with the pain. Anyone who's had any sort of life-changing physical factor can and most likely will experience some depression because it's a huge change in their life. Also think about people dealing with chronic pain. Someone who is taking medication and the pain's not going away. This in itself is very stressful. Substance abuse is also a risk factor. So we talked about marijuana, other drugs such as mushrooms and cocaine. Traumatic life events could also be a risk factor. What I want you to remember here is that what is traumatic to you may not be traumatic to somebody else. I think the important thing here to remember is when we're having a conversation with our friends, with our family, with our colleagues, is to try and be empathetic, put yourself in their shoes. Nobody needs to hear that, you know what, I did it, so you can do it too. And what I mean by that is, and I don't mean to be condescending, I mean that oftentimes we make assumptions about people's situations. And oftentimes, people aren't looking for advice. They're looking for someone to speak to. They're looking for someone to listen and to understand. These traumatic life events are individual, okay? Psychological and social factors also play a huge role in our overall mental health and our mental well-being. So a social factor could be something like poverty, right? And a psychological factor could be something like bullying. Now, oftentimes, I do go out and speak at schools, elementary schools, high schools, colleges. Supposed to be going to a college tomorrow, but unfortunately, they're on strike. So oftentimes, when I'm going out to schools, you know, we address bullying. But I have to be honest with you. I go out to a lot of workplaces, and I get a lot of calls from people in HR, and oftentimes, bullying is happening in the workplace. Okay? So it's something to think about. Again, like I mentioned earlier, we really need to step back and think about the words that we use and how we talk to people, because these words are affecting other people's mental well-being. So you may be asking yourself, how do I know if it's a mental health problem that's going to go away, or how do I know if it's a mental illness? These are the first 3 key deciding factors that I want you to remember. You are going to get a copy of this presentation. So when we want to be concerned, whether it's for ourselves or a loved one or someone that we're working with, is that it needs to be a change. There needs to be a change in behavior. And why I say this is because, let's be honest, I mentioned already that life happens. We're all going to be angry, sad, happy, excited, annoyed, you name it, we're going to feel it because we're human beings. I don't want you to forget that, because we are going to have bad moments in our life. All right? So if I'm having a bad week, a bad couple of weeks because, for example, someone passed in my life, this is normal human processing. But what I want you to remember is, when things are happening in our life, are there changes in our behavior that are consistent, right? So if I have a bad weekend, but Monday rolls around and I'm feeling better and I'm feeling more in control because I've done some things to help the situation, that's not necessarily a mental illness, right? It could be stress, it could be anxiety, for sure. Now, we're looking for consistent changing in behavior, and when I say consistent, is it happening on a day-to-day? More than 2 weeks. So what that means is, if I were to go to the doctor and I were to say, well, I've been crying all weekend, I've been very upset, X happened in my life. Well, the doctor is going to ask, hopefully, what's going on in my lifetime. Maybe something happened at work, maybe I'm arguing with a spouse, maybe I'm experiencing PMS, okay? Oftentimes, they need a marker, and the marker is more than 2 weeks. I will tell you, from the doctors that I've spoken to and the people that I've spoken to, most people that are reaching out to their doctor have far surpassed that 2 weeks. Usually people are reaching out after months and even years before they get help. That's just a marker for doctors to use. It also has to, your change in behavior, or your behavior overall, has to also interfere with your day-to-day living. So some examples of interfering with day-to-day living could be things like paying bills, taking care of your kids, going to work, getting to appointments, socializing, things like isolating yourself. Is your behavior affecting your day-to-day? Are you able to get through the day? This is just an illustration of a sign versus a symptom. So in a nutshell, a symptom is what you feel. So I'm feeling sad, I'm feeling angry, I'm feeling itchy. These are symptoms. A symptom is what you feel. A sign is what other people see. A sign is what other people notice. So I may be, and this has happened to me before, maybe at work, and I notice one of my coworkers, their behavior is different. right? Maybe the person is usually upbeat and happy, and I notice for the past couple of weeks they're sad, they're down, they're keeping away from meetings, maybe they're looking down, maybe they're not socializing or talking to other individuals. That's a sign that I notice in them. So I'm going to talk about some warning signs, so some things to think about. Now, I will stress that everybody here, it looks like there's 45 of you here, and myself, we've all experienced this stuff in our lifetime because we're human beings, okay? So I want us to remember this, that we're human beings, that we're going to experience this stuff. But what I want you to remember, while we're going through this list, I have about 3 slides, I want you to remember this. Are any of these things on the list changing behaviors, affecting your day-to-day life, or interfering in your day-to-day life? So we have indecisiveness up here, sleep disturbances. Now, sleep disturbances is probably one of the #1 things people start to notice, is not being able to fall asleep because you're worrying, or falling asleep and waking up in the middle of the night. Okay, and oftentimes people that are not sleeping are sleeping in. An example of affecting your day-to-day life is not being able to sleep all night and then falling asleep in the wee hours of the morning and then waking up late every morning, and then you're not getting to work on time. That's going to affect your day-to-day life. We have anxiety there and feeling restless. Apathy. So apathy is a straight face, so not showing emotion. Excuse me, I'm going to have a quick sip. We also have physical upsets. This one is super important to remember. Now, one thing that I want you to remember here is that our brain and our body live in the same house. They share the same rent. So what do I mean by that? If I am upset, or I'm angry, or I'm stressed, or I've been crying even, I'm most likely going to get a headache, or a tummy ache, or a backache, or neck pain. Your body is talking to each other. So when one thing is upset, like your brain, it's going to tell the other, because they work in partnership. An example I have of this is oftentimes people go to the doctor, and I'll give an example. Going to the doctor and saying, hey doc, you know what, I've had migraines for the past 6 weeks. Now, typically what's going to happen is a prescription is going to be given. What if instead of the prescription, or aside from the prescription, the doctor asked, you know what, Tammy, what's been going on in the past 6 weeks? And I say, well, I've been writing exams and I'm very stressed out. Or I'm moving, or I just lost my job. This is an opportunity for the doctor maybe to hook me up with some counseling and medication, okay? So remember, our brain and our body, they share the same house. Extreme sadness or crying spells, this is in relation to depression, but I will say that not everybody who is depressed cries. There is a recent study that actually shows a difference between men and women in relation to depression. So with women, they tend to do more of the crying. And with men, that can actually show itself as anger and irritability in depression in men. Having a negative attitude is another warning sign. And again, I want you to remember, we all experience some of this stuff. It's, are they affecting your day-to-day life and changing your behavior and the person who you are? Some more symptoms and signs. We want you also to remember that they vary per person. We're all individual. Confused thoughts, delusion or hallucination. Overall, that is talking about psychosis. So a delusion is a false or fixed belief, meaning someone's following you, for example, or you're seeing visuals that other people don't see. And a hallucination is anything sensory, or smelling, our ears, hearing voices is the most common. Loss of interest in activities previously enjoyed. So oftentimes people that are experiencing mental health problems, something like depression as an example, would maybe stop doing things that they like. So that could be, you know, being involved on a soccer team, or hanging out with friends, or just removing themselves from situations that they would typically go to. Some more possible signs and symptoms that could come later on: extreme mood swings between depression and mania, with sometimes overly reckless behavior. So I'm referring to bipolar disorder at this time. We're not going to talk a lot about it, but overall, bipolar disorder is a mood disorder. Mood disorder is the umbrella. Depression also is a mood disorder. And someone is having episodes of depression, and they're also having episodes of mania. And this is where, so they go from a really, really low state to a really, really high state. And they also have some phases or some time of normal in between. Another sign or symptom is repeated unusual actions, such as hand washing or checking of lights. Again, everyone is individual. I hear this all the time from people: oh, I have OCD because I like to clean my house, or I'm OCD because I like my shoes in my closet. The question I would ask anyone is, how often is it changing your behavior? Is it affecting your day-to-day? Just because someone likes their house clean does not mean that they are OCD. This term is the brunt of all jokes. It's overused, in my opinion. Every workshop I think that I run, someone tells me that they have OCD. Now, if someone's telling me, I think my favorite one is a woman that I met that said, you know what, Tammy, I have OCD because I check my stove every day before I go to work. And so I asked her, I said, well, how many times do you do that? And she said, oh, just once. All right, so this would be a perfect example of not being OCD. That's just someone who doesn't want their house to burn down when they go to work. I think everyone should check their stove before they leave the house, just in case, right? So anyone that is experiencing OCD is someone that is doing it so often that it's affecting their day-to-day life and changing their behavior. Talk or thoughts of suicide is also another sign or symptom. So a couple of things I want to touch here. Often I hear, and I'm sure you've heard this before, people make comments that they can't believe that so-and-so killed themselves because they're selfish. I hear that all the time. That so-and-so is selfish, they killed themselves, they weren't thinking about anybody else except themselves. And I really want to address this, and I want you to think about something. So people with thoughts of suicide are in pain, whether it's physical pain or whether it's emotional pain, they are in pain. And the thought of ending their life equals ending their pain. They say that suicide is not about wanting to die. They say that suicide is about not knowing how to live, not knowing how to live with their pain, right? So if you know someone, or if yourself are having thoughts of suicide, I want you to get the help that you need. The list that I've given you has numerous counseling services, and I'm going to talk about our 24/7 P.L. Dufferin crisis support line that we offer. The best thing that you can do with someone that's having thoughts of suicide is listen. Listen for their reasons. Listen to why they're thinking about dying. We oftentimes cannot solve their problems, but we can connect them to the services that can help them save their own life. Like I mentioned earlier, suicide is not a mental illness. Suicide, there is a relation to depression. There is a link to depression. In fact, they say that anyone with a mental illness is at higher risk of suicide. But don't kid yourself, anybody can have thoughts of suicide, depending on situations that are going on in their lifetime. So a couple of things before we go. How are we making for time? I think we're doing all right. Some skills that are going to help us when we're thinking about mental health, when we're thinking about people in our family, people that we work with, people in our lifetime. Oftentimes, we're not really sure of what to say or what to do, and that is very fair. I mentioned that I had cancer. When I had cancer, a lot of people had no idea what to say to me. And oftentimes, I would get angry because people would say the wrong thing, in my opinion. So the first point up there is to get the information, educate yourself. If you do have a best friend, for example, that is dealing with an anxiety disorder, read up on it. Get the information that you need, right? That is going to help you have a conversation. Another thing that's going to help you when you're having conversations with individuals is to remember that when we're talking about mental illness and disorders, they are not a weakness. This is not a choice. We also don't want to forget the person behind the illness. Now, oftentimes I hear people, and I'm going to say I hear this probably in every workshop that I run, that, oh, my brother is bipolar, or she's psychotic. I want you to try, I'm going to challenge you to try and change that language. I am not cancer. Your sister is not bipolar. Your sister's name is Sarah, and she's been diagnosed with bipolar disorder. That's a huge difference. We change our language, we change the way we talk to people and we address people, right? We also want to support people's efforts. If you have someone in your life that is struggling, that is trying to deal, we want to be there for them. Right? Again, listening is key. Being flexible, assisting with goal settings, listening. What can I say about listening? It's taken me 43 years and I'm still learning to be a good listener. They say that most people listen with the intent to respond. And I want you to think about this and think about yourself. How many times has someone come to you with a problem? Like, I don't know, my pants are too tight, I've gained 20 pounds. What do? Oftentimes, we have a whole bunch of solutions for them. You should stop eating bread. You should go to the gym. Why don't you come for a walk with me every day? I'm going to suggest, instead of offering solutions or advice right off the bat, listen. Listen to what the person is saying. Listen to their problem. Listen to why they are struggling. They are going to appreciate that conversation 100 times more. Also, being aware of resources in your community. I will be talking about CMHA in a second. And also setting boundaries. Now, what I mean by that is we're going to be talking about self-care. You also have to acknowledge that you need time for yourself and that you're not going to be on 24/7. Oftentimes, people ask me how they can help someone that they love. Now, overall, when we're talking about mental health issues, I mean, even if you think about something like diabetes or cancer, the person themselves is going to have to want to get the help. They have to be the ones that are going to the hospital or going to the doctor to have the assessment, to have the test done. The only thing that we can do as supports is take care of ourselves so that we can help them mentally and physically, offering resources, having conversations, and asking questions in our conversations to help that person. I want you to also keep in mind crisis services. If you're ever in a position where you are stuck, you're not sure what to do, you are scared, you want to help somebody out, remember that there are mobile units, crisis services, 911, emergency. They're open, they're there for a reason. Now, I know that we're all online, so we probably live all over the place. So I'm not sure if you're aware of the difference between CMHA and CAMH. Now, oftentimes, when I go out, people assume that I'm from CAMH because we have the same letters in our names. So I'm going to quickly tell you the difference. When you think of CAMH, it's C, the Center for Addictions and Mental Health. When you think of CAMH, I want you to think about the hospital on Queen Street. That is what CAMH is. They are a hospital. CMHA is the Canadian Mental Health Association. We are different. We are a not-for-profit agency, and we are national, meaning that we have branches across Canada. We also offer services and programs like this one that are free of charge for people living with mental illnesses and people who are struggling. We have walk-in counseling, and we have all sorts of programs to help people living with mental health problems. Now, if you live well, I should say wherever you live, you can find a branch closest to you. You're going to visit this website, CMHA.ca, and what you're going to do is you're going to go on the top right of the screen, and it says find your local CMHA branch. You're going to type in your postal code, and it's going to pull up anywhere from 3 to 5 branches that are closest to you. The top one is the closest to your postal code. You can go on their individual website, and you can look up services that they have. Another thing that you could do is call CMHA, right? So find your local branch, find their local number, and you can call them with your questions. Any mental health related questions that you have, you could give us a call. We have an information and referral line that will be able to assist you. They're open from Monday through Friday, 9 to 5. Okay, so before we go, I want to stress that taking care of yourself is probably the most important thing that you can do for yourself. When we are working, when we are driving our kids around from soccer to baseball to hockey to dance, whatever it is that we're doing, plus taking our dogs for a walk, looking after our cats, laundry, you name it, we're doing it. We are busy people, we are a busy society. And oftentimes, ourselves, me, we are last on the list. And what I'm going to challenge you to do today is to put yourself all the way to the top. You come first. I want you to try and find time every day, whether that means 15 minutes in the morning or half an hour after work, for yourself. Think about things that you enjoy to do. Think about, for me, I like to get my nails done, or I like to go and have a coffee by myself somewhere and just people watch. Sometimes I do that just to check out to life, what's going on, the busyness of life. I think the #1 self-care thing that all of us can do, which most of us don't, is take our lunch. Take our lunch. How many people do not take your lunch, eat in front of your desk, eat in the car? That's my big thing. I travel a lot for work, and I eat in my car. So what I'm trying to do more often is stop the car if I'm traveling and enjoy my lunch, right? So take care of yourself. So this is our branch, CMHA Peel Dufferin. This is our address. This is our phone number. If you live in Peel or Dufferin, this is the number that you will call to speak to one of our representatives, and this is our website. If you don't live in Peel or Dufferin, you're going to go to CMHA.ca. Also, quick guides. So Gail is going to email you a resource guide. These are PDFs. What I want you to remember, after you look through them, I want you to remember that you could call us and we can send you free copies of quick guides. Actually, rewind. We don't send them to you. You have to pick them up. So if you go through this resource guide and you say, hey, this would be great for my workplace, this would be great for my home, this would be great to give to my kids' school, I want you to give us a call and say, hey, my name's Tammy, I work at this place, and I'd like to pick up 100 quick guides. They'll prepare them for you, and they are free. One more thing I want to mention is, before I leave, it's been a pleasure. This is my very first webinar. I hope it was to your liking. We do deliver presentations almost every day of the week. We go out to schools, we go out to workplaces, we basically, we go out to churches and faith-based organizations. We basically go anywhere and speak to anyone who will listen and who wants a mental health presentation. This is an introductory course. We have 3-hour full-day workshops on all sorts of different workshops. So having said that, have a wonderful, wonderful day. It's been a pleasure. And if you have any questions, you can chat them or send them to Gail. And you can also reach me. I'm at this phone number here, 905-451-2123. My extension is 446. So Gail, do you want to take over?
Hi everyone. Thank you so much, Tammy, and thank you everyone for attending. That's all we have for time we have for our webinar today. I just asked that you take a few minutes to answer today's exit survey. We're going to be sending it out to you very shortly. This will just help us improve our future webinars and also hear back from you on what you would like us to present to you going forward. We will also be sending you a follow-up email with the alert of the on-demand status of today's webinar so that you can view any material you may have missed. Also, on behalf of myself and Tammy and the entire team at Peel Halton Local Employment Planning Council, thanks again so much for joining us and taking the time to view our presentation. It was a pleasure spending this last hour with you, and have a terrific day. Bye, everyone.